Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello, I'm Steve Pine, and I'm a partner in the firm's Research Triangle Park, North Carolina office. My practice focuses on assisting health systems on issues related to healthcare litigation and regulation, with particular focuses on payer-provider disputes, clinically integrated networks, and value-based payment models. And I'm pleased to be joined today by Gabe Scott, whose practice centers on assisting hospitals and other healthcare providers with regulatory and transactional matters, with a particular emphasis on reimbursement, fraud and abuse, and technical payment issues. And in this segment of Triage, we're going to be talking about the intersection between provider participation in alternative payment models, which we'll be often referring to throughout this podcast as APMs, and hospital preparedness in response to the COVID-19 pandemic. And we'll discuss a recent survey which found that hospitals with experience participating in alternative payment models were more likely to use a variety of strategies to coordinate care for COVID patients than compared to non-APM hospitals. And finally, we'll explore some potential takeaways from this survey that may be of interest to the healthcare community and government policymakers as they consider how best to prepare for future pandemics. And I got to add, I'm particularly excited to have Gabe join us for this episode, as prior to joining K&L Gates, he actually spent several years at CMS, where he worked on developing and managing alternative payment models, such as bundled payments and shared savings models. So welcome to the podcast, Gabe.
Thanks, Steve. Yeah, really glad to be here. I think what is particularly noteworthy in regard to the survey findings that you mentioned and that we'll discuss in detail in a moment here is that the tools and strategies that hospitals with APM experience used to respond to the COVID pandemic were, really many of the same things that they've been employing for years to be successful in their respective APMs, which typically, as many folks know, involve trying to provide more holistic care to the patient while lowering the cost of that care. For example, we know that patients with other health conditions such as diabetes or COPD, they tend to have higher COVID infection and mortality rates. And so here was an example when, treating the higher risk COVID patients, a hospital, can not only focus on the COVID diagnosis, they have to have processes in place to address the patient's other conditions as well. And so that should signal to CMS and third-party insurers that alternative payment models are likely to be a tool that they can leverage not only to prepare for future pandemics, but also to incentivize providers to furnish more complete care to patients rather than treating patients in silos according to particular diagnoses.
Really interesting, Gabe. And so the survey you referenced, what results did it specifically find?
Yeah, so, as is widely known, earlier this year, the U.S. healthcare system experienced a massive surge in hospital visits due to COVID-19 infections. This survey was by Premier, and it polled nearly 250 hospital organizations around the country and asked them, what kinds of care systems were used to address that patient surge. In terms of highlights, what we thought was particularly interesting is that the survey found the following. First, 82% of providers participating in alternative payment models used some sort of care management support to manage COVID-19 patients, as opposed to 51% of those providers that didn't have APM experience. Likewise, 55% of APM participants used triage call centers versus 31% of non-APM participants. Further, 49% used remote monitoring versus, again, 30% of non-APM participants. And finally, the survey found that, 43% of providers with APM participation experience used population health data to manage and predict cases versus 20% of non-APM participants. So I think there are a couple of really important takeaways from these findings. First, it suggests that APM participants probably have more resources available than their non-APM counterparts, because so many of the things that I just mentioned, those don't happen unless providers make a conscious decision to choose, to spend money to make them happen. Which, of course, that has to be a consideration when CMS thinks about creating policies that impact providers of all types and sizes, such as regional or rural providers. But I think that investment piece is something that, it's sort of a fact that gets lost or has been forgotten over the last several years as APMs have become more common. Many providers, particularly sophisticated entities such as academic medical centers and multi-campus hospitals, they made substantial investments to prepare for APM participation. And here with COVID, we're seeing some returns on those investments in that even some very large organizations were able to be nimble and to adapt more quickly and easily to hospital surges than others. So that's one thing. Secondly, I think the survey results suggest that CMS is likely to continue to explore ways to encourage APM participation, or alternatively, to apply certain concepts that are present in APMs to non-APM participants. And so, one example of this is the significant changes that CMS made in 2019 by creating new Medicare covered services via the virtual check-in service, the remote evaluation of a video or image service. These services, they look like telehealth, but they're not paid like telehealth under Medicare. And those ideas largely came from lessons learned in alternative payment models. CMS saw what successful providers were doing to lower the cost of care without sacrificing quality. And then they took some of those ideas and they applied them more broadly outside of the APM context.
And certainly the payment policy waivers offered to providers in some of these APMs made some of those benefits possible, as did many of the COVID-19 specific waivers that CMS issued to give providers, for example, increased flexibility in regard to those telehealth and telehealth-like services. But this seems to suggest to me that if CMS were to extrapolate findings of this survey, you would think that the agency might use the COVID pandemic as a real learning opportunity to develop payment policies that incentivize certain behaviors that are commonly supported within APMs. So I guess one question is whether you think a future trend will be a growth in APMs in response to COVID, or perhaps greater implementation across non-APM platforms of these types of policies often found in APMs?
Yeah, that's a great question, Steve. I think it's likely to be the latter. Although CMS continues to develop and test new alternative payment models, there seems to be an appetite within the agency to make changes outside the APM framework, particularly in telehealth and in care management. One sign of this is that the robust telehealth waivers issued in response to COVID suggest that CMS is likely serious about making significant changes to how telehealth services may be delivered, who can furnish those services, and to what kinds of patients. And so I think we should expect that the expansion of coverage of the quote unquote non-telehealth services like the virtual check-in and the remote eval are merely the first step in greater telehealth flexibility. Similarly, having care management systems in place to coordinate care outside of the inpatient setting and to follow the patient to make sure he or she gets the care they need to prevent rehospitalizations. These are not novel ideas of CMS. They already have things in place like the hospital-acquired condition reduction program to encourage these types of care. But based on the survey findings here, where only half of non-APM participants were using care management models, only 31% were using triage call centers. Those results suggest that if broader adoption of those tools is a priority for CMS, they're going to have to create new policy to incentivize it. And so one way to look at these survey findings is to say what COVID has exposed is that some providers are not using these systems, these strategies to their full effect. And that's likely to be of interest to CMS when it thinks about future payment policy changes. And so, thinking again about the survey results, I think the question becomes, if providers know that some of these strategies may be effective in addressing quality and cost of care during COVID, what should providers do to prepare for potential future changes to reimbursement, that incorporate these strategies. And so, in your practice, Steve, as you advise providers that are participating in APMs, as well as those who don't have that participation experience, are you finding that providers are asking these questions? And, if so, how are you advising them?
It's interesting, and I think this is a period of significant tension for a number of healthcare providers in the sense that, on the one hand, you have data like this information coming out from Premier showing that this movement towards breaking down silos and providing complete care really can make a tremendous difference for patient outcomes. And that is true even when, and perhaps particularly when, a health system experiences an unexpected shock like COVID-19. The benefits in being able to respond to a global pandemic were surely not high on health systems lists when they made the initial decisions to invest in population health, but now that investment is proving to have these real and unexpected benefits. Of course, on the other hand, the pandemic has brought, I think, significant uncertainty to health systems across numerous fronts. So how long will COVID be with us? What will future waves look like? How will patient care evolve in a world of greater social distancing? And on the reimbursement side, how will APMs and the systems and payers that manage APMs account for the COVID-19 challenges health systems face that could negatively impact the metrics used to determine payment under those models. And I think the good news is that payers do seem to recognize these issues. And for example, for Medicare APMs, CMS has started taking steps to adjust methodologies and otherwise adapt reimbursement for these COVID-19 impacts, and is likewise changing care models, for example, accounting for a shift to telehealth. And we hope that for that to continue, and likewise that for commercial payers, they will similarly be nimble in adapting their APM relationships with providers. And so I guess finally, just anecdotally from my own experience, it does look like most health systems are maintaining a longer term view now, and recognizing that the challenges associated with COVID-19 will ultimately be temporary, while these benefits associated with integrated population-based care are perhaps even more robust than originally thought.
Yeah, thanks, Steve. That's such an important point that, particularly during these periods of uncertainty, if CMS and commercial payers continue to preach the benefits of population-based care, there are going to need to be flexibilities that are offered to providers so that providers stay the course and don't revert back to, largely focusing on volume-based care. We will leave you with that thought. Steve, thanks so much for your time. Thanks for having me on to participate here. And thanks to our listeners for your interest in this Triage episode on the intersection of APM participation and COVID preparedness. If you have any topics that you would like to see discussed via Triage, you can either complete our survey that's linked in the show notes in the K&L Gates Podcast Center, or you can email us. We would love to hear from you. We at K&L Gates will continue to monitor changes to Medicare payment policy, and we will provide ongoing updates. But in the meantime, if you have any questions, please feel free to contact us. Thanks again.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.